Hello and welcome to Arab Health Week 2021. I'm Sandra Garlick, your host and moderator for today. And whether you're joining us for the first day today on day 3 or whether you've been with us all week, I'm really looking forward to a packed programme for the final day from our expert speakers and presenters. But don't forget, we're here to share best practice, collaborate, innovate, build a community of dynamic, engaged healthcare professionals and learn from each other and collaborate efficiently going forward. Remember, you've got the chat box there, so please use it, please connect with each other, and you've got your connection panel there so that you can arrange those meetings and follow-ups afterwards. We want you to connect, we want you to network, we want you to get to know each other from around the globe. Remember, we've got a hashtag Arab Health Week, so please feel free to use that on your social media channels and to connect with us. And do remember that these videos, everything is recorded and you can watch it back on the Future Health YouTube channel. I'm really looking forward to today's sessions. We've got some really exciting speakers coming up for you. So here's what's coming up this morning. We've got cybersecurity, evolving threats during post-pandemic COVID with Ashish Khanna. We've got Dr. Yunus Kazim talking about Dubai's health authority strategy, and Dr. Salman Dalvi, who's going to talk to us about introduction to stem cells and regenerative medicine. I'm really looking forward to these speakers. So without further ado, let's go over to our first technology keynote session, cybersecurity, the evolving threats during and post-COVID-19 with Ashish Khanna.
Hi all. My name is Ashish Khanna, and I am a cybersecurity professional in a government healthcare organization. And I'm here to present to you with the cybersecurity challenges and what we should do during these evolving threats that we are facing in these unprecedented times of COVID-19 pandemic. Before we begin, just a small disclaimer that the contents and thoughts represented by me in this presentation are entirely personal and they bear no resemblance to my current organization or its third parties or its customers, and all photos, logos, or text, etc. is used for representative purposes only and are only a means for educational or any kind of representation. Okay, thank you all for joining. This year, which is 2020, last year, in fact, 2020, it will be the one that will be remembered for a very, very long time. And 12 months ago, very few of us could have foreseen the global disruption that would be caused by COVID-19. It's the worst pandemic in over a century. And the seismic changes that have affected our lives almost overnight continue to be felt till date. And maybe, hopefully not, but maybe beyond 2021 as well. So as we move forward, I'm going to go through 4 key agenda items. Healthcare, definitely everybody is now well aware of the steps that they need to take, but is it healthcare or COVID has made it like a healthcare in terms of cybersecurity? Then the effects that the nation-state sponsored actors have caused, the threats from these nation-states and criminals to our healthcare systems globally. And it's a very, very big growing concern at this point of time. And how to protect our institutions, healthcare institutions, against various cyber attacks. And last but not least, we'll briefly touch base upon zero trust model for healthcare and how to adopt certain practices that will take us through the zero trust approach. See, with social distancing being critical to slowing the spread of this coronavirus, we needed to transform all the aspects of the way we live, from our working environment to our home environment, to shopping, to interacting with the families and loved ones. The internet has, enabled us to keep our world still running and keep going. And globally, businesses have surprised themselves with the speed and success of these digital initiatives that we have been taken. It's actually has been estimated during 2020, that is last year, the digital transformation had advanced up to 7 years earlier than it is expected, thanks to this pandemic that we are still going through. And it was once thought that it will be almost impossible, that has been achieved in a few months' time. Of course, the giant leap in connectivity and our growing reliance on technology has taken our lives, has also brought us with new challenges and problems. Just as organizations worldwide have transformed their ways of working, these threat actors and cyber criminals also changed their tactics so that they could take advantage of the pandemic's disruption. We saw huge spikes in attacks against healthcare entities, and especially in remote working hours. And we have also witnessed, as a cybersecurity professional who has been monitoring such situations daily in and out, that there have been surges in phishing attacks targeting people or workers who are at home or at office, aiming to steal their personal details, their professional working environment details. So there were major increase in ransomware and exploits that was very shameless, and sophisticated hacking attempts have been made against healthcare organizations and companies involved in making, shipping, or even researching on COVID-19 vaccine. See, over 22 billion records have been exposed to data breaches worldwide in 2020 until date, in about 730 publicly disclosed breaches. So you can imagine how many breaches have been, have gone undisclosed at this point of time. At the start of 2020, around March, the major hacking groups like Maze and Doppelpaymer, they pledged to refrain from attacking healthcare institutions, which was struggling to keep up with an increased amount of workload, dealing with the virus insurgencies and dealing with an overwhelming number of patients. But some of the groups even went so far that they announced or gave public statements. They provided free decryption services for institutions who were mistakenly attacked or were subject to attack that they were still recovering from since 2019. Among these groups was a prominent the Maze ransomware group, who committed and issued a public statement saying, and that we also stop all the activities versus all kinds of healthcare institutions or pharmaceutical companies. But soon, as 2020 progressed, it became increasingly obvious that such promises, they hold no substance. In fact, in 2020, attacks targeting healthcare institutions, medical institutions, pharmaceutical organizations, and research centers have increased. They were executed at an unprecedented rate. And in April, the Hammersmith Medicines Research Limited, HMR, which is a research firm that was at that time on standby to perform the traits of COVID-19 vaccines in humans, and also they are currently responsible for doing some genome-related studies. They suffered one of the huge data breaches by the same hacking group, which is Maze ransomware group. And then when investigations were done, it was revealed that breach occurred on March 14, almost in parallel to the same time when this Maze ransomware group actually had a public statement being delivered through the internet or Twitter. So as HMR decided not to pay the ransom, the data was published on Maze's designated web page that can be accessed through Tor or other areas of dark web. So shortly afterward, we observed that there was a huge escalation in healthcare-related attacks as threat actors became, known about these urgent activities that were going globally. They began focusing on medical facilities, working to mitigate the coronavirus contagion, as well as pharmaceutical institutions working to develop vaccines. This activity continued throughout 2020. As you can see, there is a chart in front of you. This chart demonstrates the increase in attack that is related to healthcare organizations throughout 2020 and close to 2021. If you see closely, recent research has also depicted that October showed the healthcare is currently the most targeted industry in the world. Around 70% of attacks globally from September to October were focused, 2020 that is focused towards healthcare institutions. It also shows a sharp increase of healthcare sector related attacks compared to the global increase in November and December 2020. And then it has also continued in January 2021. Until date, healthcare is second most attacked industry in the world after banking. And even in the UAE, it was considered that 2020 was a year of cyber pandemic. Hackers have taken the advantage of COVID-related digital adoptions in the country, and UAE also recorded about 250% increase in cyber attacks, which were focused usually with techniques like phishing and ransomware incidents, with a high number of rate or degree of success. Moving forward, again, some enlightenment on the top four healthcare related security breaches that have happened. And in totality, as per the HIPAA journal, it has been observed that 28,756 odd healthcare records have been exposed so far. And the exploits, the fears have been taken towards the escalating situation that has happened amongst the population. Cyber criminals have reframed their phishing attempts to launch targeted cyber attacks by taking advantage of already feared population globally. And number one of the attacks, the Universal Health Services, I think many of us might have been aware of. The ransomware attack across is 400 locations in September. And then data of five different healthcare institutions was actually put on the dark web for sale by different hacking groups. And UCSF, one cannot forget this, UCSF, which is the University of California, San Francisco Medical School, they claim that NetWalker ransomware actually affected them, multiple servers, which are very critical, and they had to pay a ransom of about $1.14 million to get out of it. The fourth one being again in October 2020, where DHS CISA issued a warning of Emotet Surgency, which is a very, very problematic ransomware that has targeted almost more than 20% of prominent hospitals. Now, from the agenda, I said that the nation state-sponsored actors are a growing concern, especially when they are targeting the cold supply chain vaccine distribution system. And it is not an easy way to do it, but they have been doing it continuously through cyber espionage techniques. Now let's take an example that, because we all here are quite familiar with Pfizer and BioNTech vaccine, which was the first one to come on board for COVID-19 treatment. And there has been targeted campaign against the distribution of this vaccine particularly. Everybody is aware that the transportation of this vaccine cannot happen below negative 70 degrees Celsius temperatures. So let's take a quick view of how, in short, how this supply of vaccine delivery actually happens. So the new vaccine would need a deep freeze delivery chain that everybody knows, because it has to be delivered at a negative of 70 degrees Celsius temperature. So vaccine is sent to destination in a special dry ice packs, let's say example of 5,000 doses by air. And then the destination country can choose to store the vaccine in a freezer farm that is again maintained at negative 70 degrees Celsius. Now, in the unopened dry ice packs, these vaccine doses can be there for 10 days because it can take around 10 days to reach the government designated or privately allowed vaccination centers. And the final step is before it is provided to the to the people is once delivered, this vaccine can be stored for up to 5 days in a normal freezer at a 2 or 8 degrees Celsius temperature. Now, what happens is that the attackers impersonated a business executive from a legitimate Chinese company which was involved in supply of these cold chain equipment that is used to transport these vaccines, and they did by sending him or her or engaging him into a phishing email. Then they sent some emails that were basically targeted at the transportation system, which contained malicious code, and these emails actually espionage the credentials of people who were involved in managing these transportation systems. Now, this could have been allowed to them to understand the infrastructure the governments are intended or they have made to make sure that supply of vaccine is smooth and is delivered to the people. So such advanced insights into the purchase and delivery and the supply cold chain of these vaccine can impact the global economy as well as the lives, because it's a very, very high value, high priority target. Moving on, we have also observed that nation-sponsored APT groups, that is Advanced Persistent Threats, including North Korean Lazarus Group and Russian Fancy Bear, they have been targeting institutions that have been involved in the treatment and developing or carrying out certain researches on genome studies and vaccine studies related to COVID-19. Another one is where cyber blackmailing is quite popular now, because a recent report has revealed that, especially from the firm Positive Technologies, says half of all the cyber attacks on healthcare were ransomware attacks from July to September 2020. Now, why all of this is important? Because we need to understand that it's a very, very easy payout at this point of time. Attackers now understand that the concept of clinical urgency, if they create a risk and disrupt the ability to provide patient care, they are more likely to be paid than at normal times. Moving forward, as we can see on this map, that the world has been affected globally by COVID-19 and also by various cyber espionage and cyber attacks. The major 6 techniques that have been used by the cyber criminals have been ransomware, emotet-related attacks, phishing escalations. I already told that phishing escalations were one of the keys to the cyber pandemic era that UAE is going through. Web attacks, trick bots, and crypto miners. Crypto miners are the most recent ones, and they will be developed even further as we move into 2021 or towards its end. In fact, emotet attacks are those attacks that have resulted into 20% of the attacks globally in healthcare. So, which is a very, very huge number. So this means that attackers are looking towards emotet as one of their more easily usable techniques and tactic to penetrate organizations globally. And as healthcare systems are not made for security, they are made to save lives. They are made to give proper patient care. So it's even more easier to penetrate such systems and organizations through these sophisticated tactics. So what do we do? See, every part in this chain actually matters. Now, how to protect the healthcare institutions against such vicious and unprecedented cyber attacks in these unprecedented times? We can follow 4 key steps or 4 key areas where we can strengthen our organization's infrastructure. We can strengthen the technology backbones of our infrastructures so that our organizations are more robust and we can deliver better continuous patient care, and have a continuous model of supply chains. Enable multi-factor authentications, continuously do vulnerability assessments and penetration testings to keep on finding those backdoors that can be used to deliver ransomware or internet-related attacks. You need to generate more and more awareness. We need to turn our employees into a cyber threat shield, which means every individual or staff is, if vigilant enough, it will be difficult for these threat actors to find an opening for an attack. Increase resilience. This is a key. Increasing resilience is a key because that's the best way to minimize the damage that is caused by a cyber attack, that can be easily achieved by employing better offline backup, storage, and restoration services. Because once you are attacked, rather than going into a mode of payouts or reaching to different organizations, it is best to create the environment as quickly as possible through restored backups and storage solutions. This standard security protocol is especially effective against ransomware attacks. And implementing multi-factor authentications, it's really important that across enterprise networks, it is a very effective way to get rid of some of the most disastrous vulnerabilities that can be left untouched or through your patching systems. It's very critical to follow such simple steps to reach out to better security states rather than having no security state at all. So an introduction to zero trust. This is a new outlook of securing the healthcare enterprise, a digitally transformed healthcare enterprise. Because zero trust means that you need not trust not even a single device, a user, workload, or system that either it is inside or outside of your security perimeter. This is very. It looks from a healthcare professional's perspective, where the profession itself is based on trust. It's very difficult to understand this concept because it is where we are not trusting whatever is around us or given us to to provide patient care, which means that you need to explicitly always verify the details, verify the accesses, verify the users, verify the devices again and again to make sure that the devices which are communicating with each other, the devices which are communicating with your EMRs or EHRs or electronic healthcare record systems are trustworthy, are in the similar security state, are behaving normally the way they should behave according to your security policies, so that you don't feel the burden of leftover backdoors in these systems that can destroy your healthcare environment and eventually cause disruption to patient care. Then you need to limit the user access. Use principles of least privilege access and limit the users, give them access to on need to know basis. Not every doctor, every nurse, every physician, registrar, consultant, head of department, directors need access to everything in your environment. They need access based on the work they do. They need access based on the kind of patients they treat. They need access based on the kind of devices they use. So they need to have a profiling of these users, the fingerprinting of devices, and fingerprinting of your network components, the unknown areas of your network, the east to west traffic, the north to south traffic that is coming in and out of your organization has to be limited to be given access to users according to their work and not according to the reputation, not according to the kind of culture you follow. Because everybody is trusting each other as human being, but we cannot trust the devices. We cannot trust the users' actions. There can be rogue insiders who can give out information or can leak out information unknowingly because they might be attacked by they clicking an unfortunate link that they received in a phishing email. So we need to be vigilant and on our toes when it comes to developing these security policies on the devices, which although give businesses the chance of providing good and continuous patient care, but in a controlled environment. And always assume that the breach has already happened. That's the key difference between cybersecurity and achieving resilience, because many people confuse cybersecurity with cyber resilience, but the main difference is cybersecurity always focuses on how you should be monitoring, how you should be putting in preventive measures, but cyber resiliency assumes that you might have been already attacked, that you might are already under attack, and you build the policies accordingly. You test your systems accordingly. You test them for better and better resilience. You achieve maturity, because if you assume that a cyber attacks it cannot be averted, you would make your devices more stronger. You would create policies that are more intelligent and automated, and accordingly you would perform your actions and train your users. So all these pillars come together based on your thought process of looking at your environment. These are the four key pillars to start up with your zero trust model, and it gives you a new outlook on securing your healthcare enterprise. Guys, uh, moving on, we have the other the access, that is limiting the user access, also a key, as I explained earlier. Explicitly verify. That's how zero trust revolves. You can see the shape of this DNA. That's how it should be. Zero trust should be the DNA of your enterprise IT environment, of your healthcare organization. So, guys, thank you for giving me this opportunity, and thank you for being patient. Now, I would like to welcome some questions regarding my presentation. Thank you.
Thank you, Ashish Khanna from the Dubai Health Authority, for that fascinating presentation. I'm sure we've got some questions coming in now from our audience. So I know you're sitting there in your office in Dubai. It's beautifully warm there. You've told me it's 40 degrees, which sounds absolutely amazing when I'm sitting here staring out of my window looking at the rain here in the UK. So over to some questions from our audience. How do we stay current on the cyber threat landscape?
See, we need to educate ourselves more. We need to be more aware of wherever we are working, how our enterprise is, which sector we are in, and then accordingly follow some podcasts or news articles on that subjects. Because usually the pillars of cybersecurity remain the same, but they can be translated into different aspects of confidentiality, integrity, and availability as per which sector you're working in. So this is how you can keep yourself updated.
Yeah, that's okay. But if we increase our cybersecurity with new funding and technology, do you think it's possible to end cyber threats for good?
Well, that's where the approach of resiliency comes into picture. The budgets are a concern because it is usually taken as a subject where the return on investment is not tangibly visible like other parts of an organization or an enterprise. But the main thing is that it gives you to achieve the enterprise's cybersecurity strategies, which can help you evolutionize rather than revolutionize the cyber threat landscape, and which adds on to your value in different areas of your enterprise, where you can tangibilize the revenue of organizations and how cybersecurity is helping you achieve them.
So, if you're working in healthcare, you're working in an organization, you become aware that these cyber attacks are so prevalent. How can we convince our organisations that this is a high priority expenditure as opposed to something, because there are so many competing, resources and drags on our resources for basically the money in the organisations. How can you, what do people do to bring this to the top of the agenda?
To bring it to the top of the agenda, the board of any enterprise needs to understand their commitment first towards the cybersecurity of the organization, how it's critical. And then we as individuals who are contributing to the board's vision, we should be able to bring about a cost-benefit analysis of applying these specific controls, which can strengthen the cybersecurity landscape of the organization. And thirdly, what we should do is we should also take into account the risks the organization is operating it, on a daily basis, whichever sector they are working in, whether it's healthcare or non-healthcare sectors. So this helps us quantify the amount of funding that cybersecurity teams receive and what is the return on investment that the board gets out of them. Because at the end of the day, risk is probable, but mitigating it and going to a residual state which is acceptable to the board is where your ROI would come from. And this brings about the acceptance. And as the acceptance matures, it becomes a regular function in whichever program you execute strategically in your organization.
Mm-hmm. Do you think we have all the information we need to oversee cyber risks?
Well, information is the new oil, I would say, in this age. But saying that we have all the information to avert these threats would be, that would be wrong, because not everything can be cyber safe, 100%, and you can never have, enough funding. There was a very famous movie dialogue from the movie of Pierce Brosnan, 007. Which say the world is not enough, right? So you can get as much money as you want, but that necessarily doesn't assure you that you will be cyber safe, right? Organizations like Microsoft, Google have been hacked. Universal healthcare system with 600 plus hospitals has been hacked. I'm sure there's no shortage of money there in their pool. But what we need to understand is the right mindset within the staff is important. That's why in one of my slides in the presentation, I said that make your employees as your shield rather than expecting them to fall trapped to some controls. Make your employees as one of your shields, one of your weapons to against these cyber threats. And it doesn't cost that much to make them. It's just a cultural change which the management commitment can bring about. Enterprises, small or big, doesn't matter. And then eventually, what are the key pain areas where you need technology, and to manage these two, where you need the process. So it's a threefold understanding: technology, people, and process.
And I suppose it's about educating those people, isn't it? Through training, through making them informed about what cybersecurity is and how to minimize those everyday threats that can lead to these massive exposures.
Right. Threats will be evolving always. Before NHS attack, nobody even really cared about ransomware attacks. But when they saw the expanse, how deadly these ransomware attacks can be, especially for a healthcare entity like NHS, which would be thrown away to Stone Age for a week or so, and they would have to spend £1 billion, more than £1 billion to recover from that. And it's not about money. It's about, I can only imagine that how much effort would the providers would have, given in to continue patient care, where you don't have access to the system which can give you the right history of the patient or diagnostic information. It would have been they would have been living in the old age days where they would just rely on their knowledge and experience to assess a patient situation.
Yeah, I mean, you talked about the Pfizer example in your presentation, and so it's not always about money for these hackers, is it? It's not just purely that they want to ransom for money. Sometimes it's disruption, isn't it? Global disruption. So how do you sort of really source about where these likely threats are going to come from and what the reasons are behind them?
See, the likely threats, definitely one of the factors is money, but not necessarily. Nowadays, with the global geopolitical landscape, which is changing, even and not just enterprises, but the all organizations, the nations themselves are becoming competitive, and they are being competitive, and they're comparing themselves to other nations, whether it's national strategies or other infrastructure strategies, health strategies. And health, since the pandemic, health has become a national strategy and national concern for almost all the nations globally. So the hackers understand this sense of urgency, and they know that disruption would bring about disruption in the supply chain of curing this the world from this kind of pandemic is also once in a lifetime opportunity. The technology was not available when the pandemic struck about 300 years back, but now technology is available. So the sense of urgency and its disruption is even more of a reason to make them others feel the acceptance of hacking such systems, because many of the nations or many of the organizations operating in the critical infrastructure space of a country do not really did not used to really report these attacks. But with everything more globalized, internet readily available to access, and people really connected, irrespective of the distances that we are on. Taking the example of this conference that we are having, leaving all these stones unturned is it would be being ignorant. So all these attacks, they are just to make sure that the nations feel the sense of urgency and they can prove a point against each other. And sometimes it's even just a retaliation to an attack which has happened from any other state-sponsored, hacking group.
So you talked about a 250% increase in attacks and cyber attacks, since September, October, and it's just been getting more and more. Obviously, the pandemic has created this opportunity for the hackers. How do we stay ahead? How do we stay ahead of the hackers?
So that's what I said in my towards the end of my presentation. We need to understand that and move away from the approach of securing everything and anything. Know your crown jewels. Take the approach of cyber resiliency, where you accept that a cyber attack is imperative, right? Once you accept that, you design the controls accordingly, you test the controls accordingly. People have a different level of accountability at different levels or hierarchy of the organization. So they understand, they accept it, and accordingly they function, accordingly they behave, accordingly they culturalize the organization. So this is how you change your mindset, and with the changing mindset you will be able to bring about a change in the threat landscape of your organization as well. It's a thought process that drives the technology and not the other way around.
And if you could leave our audience with one key message today, one key takeaway that they should really, really think about, what would that be?
The key takeaway that I want to bring about from this presentation and from this discussion also is that our global need is best patient care, better patient care, and also to make that available, we are deploying the best in class technology. But we need to also understand and accept that this fact that technology doesn't bring about a change. What brings about a change is your thought process, and you need to understand in your thought process, security is also imperative for these technologies to operate. So these two pillars should go hand in hand: digital transformation, better patient care, and better security, because this is how you continue all the three aspects of your enterprise, especially for healthcare entities.
Thank you so much for your time. Thank you for your presentation and for answering those questions for our audience. That's Ashish Khanna from the Dubai Health Authority. Thank you.